Could routine medical tests raise stroke risk in seniors? Here's what you should know. Every year, millions of older adults attend routine checkups, believing they're staying one step ahead of potential health issues. But what if some of the most common medical tests performed in good faith actually increased your risk of a stroke? It may sound unbelievable, especially when these procedures are recommended by trusted physicians. However, a growing body of research and real-life cases suggests that when done too frequently or without full consideration of the patient's condition, some routine tests can quietly trigger serious complications in vulnerable seniors. If you're over 60 or caring for someone who is, this article will walk you through 5 common diagnostic procedures that might not be as harmless as they appear, especially for older adults with existing health concerns. Most importantly, we'll cover how you can protect yourself by asking the right questions, weighing alternatives, and becoming a more informed patient. 1. CT scans with contrast dye. Are they worth the risk? Computed tomography. CT scans are often used to get a clearer view of what's happening inside the body. When contrast dye is added, usually iodine-based, it highlights blood vessels and internal structures. For many conditions, this contrast-enhanced imaging is essential. But for seniors, especially those with high blood pressure, kidney problems, or heart issues, the dye itself can become problematic. Why it matters? Contrast dye can cause sudden changes in blood pressure, trigger allergic-like reactions, or stress the cardiovascular system. In some people, it even leads to vascular spasms or fainting spells. A study published in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans were at higher risk of experiencing vascular complications within 72 hours, especially if they already had high blood pressure or compromised kidney function. Real-life example: an 81-year-old man had a routine abdominal scan. 2 days later, he suffered a mild stroke. Doctors suspected the contrast dye temporarily spiked his blood pressure, allowing a clot to form and travel to the brain. What you can do: ask your doctor if the scan is truly necessary. Discuss your complete medical history, especially any issues with your heart or kidneys. Inquire about alternatives, such as non-contrast imaging or ultrasound. Always ask, can this scan be done without contrast? 2. Exercise stress tests. Valuable or vulnerable? Stress tests are designed to assess how your heart performs under physical pressure, usually involving walking or jogging on a treadmill while being monitored. For young, healthy individuals, this test can be routine. But for seniors, especially those with underlying health issues, this type of exertion may pose risks. The concern: raising the heart rate too quickly in someone with weakened arteries or existing heart conditions can result in elevated blood pressure, irregular heartbeats, arrhythmias, or, in rare cases, rupture of delicate blood vessels. A 2020 analysis in the American Journal of Cardiology revealed that about 7% of patients over age 65 experienced adverse reactions during treadmill-based stress tests. Most of those individuals already had vascular issues. Case to consider: Margaret, a 74-year-old with hypertension, was sent for a precautionary stress test. During the treadmill portion, she experienced dizziness and chest pressure. The test was stopped, but the following day, she suffered a minor stroke. How to stay safe? If you're not experiencing symptoms like chest pain or shortness of breath, ask if the test is absolutely necessary. Ask your doctor about alternatives, such as a pharmacological stress test, using medication instead of exercise, or a resting echocardiogram. Make sure the benefits of the test outweigh the risks in your specific case. 3. Sedated endoscopies. Harmless or high risk? Endoscopic procedures, like colonoscopies or upper GI scopes, are often recommended for preventive screening, especially after age 60. These tests frequently involve sedation to help patients stay comfortable. However, that sedation can lead to unintended complications. What's at stake? Sedation lowers your blood pressure and alters circulation. When combined with medications like aspirin, warfarin, or other blood thinners, which many older adults take, this can increase the risk of internal bleeding or even small strokes. One large-scale review in gastrointestinal endoscopy showed that patients over 65 who underwent sedated endoscopies had higher rates of transient ischemic attacks, also known as mini-strokes, within a few days post-procedure. A real-world example: a 76-year-old woman underwent a routine colonoscopy with sedation. Though she felt fine afterward, 2 days later she began slurring her speech. A mild stroke was diagnosed, potentially linked to a drop in blood pressure during the procedure combined with her daily aspirin use. Your options: talk to your doctor about whether the endoscopy is truly necessary right now. Discuss your medication list, especially blood thinners. Ask if the procedure can be done with lighter sedation or no sedation at all. 4. MRI with gadolinium. Contrast: hidden danger to your kidneys and brain. Magnetic resonance. Imaging, MRI, provides high-resolution views of tissues and organs. When contrast dye, often gadolinium-based, is used, these images become even clearer. But gadolinium is a heavy metal, and in aging kidneys, it may not be flushed out as efficiently. The risk: in seniors, reduced kidney function, even mild, can lead to gadolinium remaining in the body longer than intended. This has been linked to a rare but serious condition called nephrogenic systemic fibrosis, NSF, as well as suspected neurological symptoms like confusion, disorientation, and balance issues. A 2019 study in radiology tracked over 2,000 seniors who received contrast MRIs. About 5% experienced symptoms such as dizziness, vision problems, or stroke-like episodes afterward. Many had undiagnosed kidney issues. Veteran story: Harold, a 79-year-old veteran, had an MRI for back pain. His scan used contrast, even though no one had tested his kidney function beforehand. He later experienced brain fog, lightheadedness, and fatigue. Blood tests showed he had undiagnosed stage 3 kidney disease. Prevention tips: before undergoing a contrast MRI, request a kidney function test, GFR. Ask if a non-contrast MRI is possible. Let your doctor know about any past reactions to imaging dyes or medications. 5. Carotid ultrasounds. Is screening always necessary? The carotid arteries, 2 major vessels on either side of the neck, deliver blood to the brain. With age, plaque buildup in these arteries is common. A simple ultrasound can detect narrowing or blockages. But is that always helpful? The gray area. If you have no symptoms, like dizziness, vision changes, or weakness, finding moderate narrowing may not warrant surgery. In fact, research shows that interventions like carotid endarterectomy or stenting don't always reduce stroke risk compared to medications and lifestyle adjustments, and they carry risks of their own. A landmark study in the New England Journal of Medicine followed thousands of seniors with asymptomatic carotid narrowing. Many who underwent surgery experienced no added benefit, and some suffered strokes as a direct result of the procedure. What happened to Helen? Helen, 82, had no symptoms but received a carotid scan during a wellness check. It showed 65% narrowing. She underwent surgery but had a stroke during recovery, leaving her partially disabled. What you should ask: why is this scan being ordered now? What will we do if it finds something? Can we manage it with medications instead of surgery? Always seek a second opinion if surgery is suggested without strong symptoms. As we age, our bodies respond differently to medications, procedures, and even routine tests. While technology has helped us detect and treat illness earlier, that same technology, when used indiscriminately, can sometimes do more harm than good. Before agreeing to any medical test, understand why it's being recommended. Ask what the results will change about your care. Make sure your full medical history is considered. Know your alternatives. Being an empowered patient means asking the right questions, even when it's uncomfortable. Your doctor is your partner, not your boss. When you advocate for yourself, you're not being difficult. You're being responsible. Your health, your voice, your choice. If you found this information helpful, share it with a loved one. And don't forget to subscribe to Wellness Path for more no-nonsense guidance on aging wisely and staying well.